my name is Miranda Monk. I'm currently a pharmacist at Massachusetts General Hospital. I am originally from Bangor, Maine. I attended URI from 2012 to 2018, graduating with a class of 2018. Why did I choose URI? So I think originally I fell in love with the school itself and then realized that they offered a pharmacy program. And I wanted to do something that was challenging and involved chemistry and math that was in the healthcare field. So that was really what drew me to URI specifically, and then also the College of Pharmacy.
Okay. Yeah, it's interesting because I didn't know I wanted to be a pharmacist exactly either, and that's kind of the same reason I chose URI. I guess living in Rhode Island kind of made that a little easier,
Yeah.
just convenient at least. So yeah, interesting. So do you want to just kind of go through maybe what like a day at work kind of looks like for you, or
Sure.
maybe start with like your title?
Yeah, so currently I'm an advanced clinical pharmacist at MGH, or Massachusetts General Hospital. Currently, with the surge of COVID-19, I am working in the burn ICU as well as a pop-up ICU to help with the overload of intensive care patients that we currently have. And I've been doing that for the last 3-ish months. And I also did that earlier in the pandemic last spring as well. My primary job is on a medical surgical unit. So I have a thoracic and vascular surgery unit as well as a hospital medicine floor. So those are my primary floors that I kind of jump between depending on the time and depending on where we are in the pandemic and our hospital status. I guess a typical day, again, it kind of depends on where I'm covering and what I'm doing, but essentially for a med surge, which is mainly my typical unit, you have around 2 hours to kind of pre-round on your patients, and then you'll attend rounds for both of the floors that you are currently covering. And some of those are multidisciplinary rounds where you're kind of working with social work, you're working with physical therapy, occupational therapy to kind of guide the patient upon discharge and see how we can really help facilitate some medication things for that. And then that usually will take up most of the morning. The afternoon is spent a little bit differently with catching up on projects, catching up on anything patient care related. It's usually filled with quite a few meetings, precepting topic discussions. There's never a shortage of things. And then during my time in the ICU, it's a little less time to pre-round in the morning, usually an hour or less. You come in a little bit earlier, and then you round from anywhere from 2 to 4 hours, given how many patients you might have in that unit. And then again, same afternoon sort of precepting, doing topic discussions, doing your own learning, and following up on any patient care related things.
Okay. So you mentioned a few things that I want to, I guess, learn more about. So you precept residents, right?
Yes.
So kind of what goes into precepting residents? Are there any kind of like requirements that you need to be able to precept residents? Or is it something that any kind of pharmacist that's working in a hospital can do?
Yeah, so that's a great question. So it depends on the hospital. It depends on your rotation. ASHP does do accreditation of preceptors. So currently I'm a preceptor in training by default. After your PGY 1 year, you are allowed to basically have, I believe, 1 to 2 years of training before you are a full-fledged preceptor. So essentially what happens and what's the difference between what I am currently doing versus a full-fledged preceptor would be when I do my evals with my students or evals with any residents, that I have someone else sit in on them and then they give me feedback as well. So it's kind of this constant feedback loop. As far as other kind of resident items go, it depends on how to help them facilitate their year based off of where they are in their year. I had a PGY 1 on my med surg rotation in December, and then I ended up getting pulled to the ICU. So it was kind of a last minute COVID decision, but essentially just seeing where they're at, what they're comfortable with, and helping them through. We have 4-week resident long rotations here at MGH.
Okay. And then the other thing I wanted to ask about was, you said kind of apart from the morning rounding or pre-rounding, working up patients, going to rounds, you work on some projects throughout the day.
Sure.
So I'm just, if you kind of give like some examples maybe of projects that you've done
Yeah.
or projects that pharmacists maybe get involved with in the
Sure.
clinical.
So it's pretty much as driven as you want to make it. So currently, or in the last few months, I've been working on remdesivir. So that was a new approved treatment of COVID, I think last May. So essentially, we did a retrospective review of all of our patients who are on that prior to it becoming FDA approved in October. So I ended up chart reviewing over 150 patients and kind of looking back at their course and filling out a survey. So that was the most recent project that is fresh in my mind and took up a lot of time. But other things that I serve on a credentialing committee. So essentially for pharmacists to dose vancomycin and aminoglycosides, my colleague and I are co-chairs. And we have our committee meetings, and we will kind of work with other disciplines to make sure that they are, up to speed with our protocols and what we can do for them from a pharmacy standpoint. So there's a good balance between like research committees, also doing drug reviews, formulary reviews. I think probably once a month I'll get asked to do some sort of drug review and kind of do a write up with it to send to P&T.
Okay. Sorry.
No.
My struggling with my tabs here. So what would you say your favorite part about working as a clinical pharmacist is?
Yeah, I definitely think it's the team-based effort and the team-based care that I get to be a part of. Every day, I would say a huge part of my day is working with mid-level providers, whether it's NPs or PAs, or even residents, depending on what floor I'm on. And working with them, working with nursing, working with PT, working with OT, nutrition, and then the attendings themselves is just such a cool collaborative effort that I feel like we have such a cool part in. And there's literally nothing better than, you kind of come onto the unit and they're like, oh, yes, pharmacy's here. And you're just like very happy to be a part of the team. And they can, they'll be like, oh, sorry, we started that yesterday and we didn't really have pharmacy's advice. So let's fix that today. So it's nice to hear every day and kind of feel validated that they appreciate your help. And they really do look for you as part of the team.
Right. And while I was at Mass General Hospital, both with you and then in the bone marrow transplant unit, I noticed a lot of the same kind of thing. Like pharmacy was really involved in rounds, especially on the bone marrow transplant unit, and like super involved in all the decisions and stuff, which I thought was really cool. Like I've worked in a community pharmacy and I've worked in like a small hospital in Rhode Island, but that's just kind of like as a technician or an intern, kind of just going through the motions. But it was really cool to me to kind of see how appreciated pharmacy is in a clinical setting. And I can definitely see that being kind of one of the cooler things of having the position. Where did I go? Here we go. So kind of talked about teamwork, projects. So you are board certified.
I am.
That is correct. Do you want to kind of talk about what that process is like? Kind of what it means to be board certified, how you go about becoming board certified, the preparation that's involved.
I will say, as a student and even as a resident, this whole process is very interesting and very up in the air, and not really something that you really learn about until a little later on in your career. It was always something that I knew I wanted to do, but I didn't know how to get there. But as with many things in pharmacy, I feel like you kind of talk to your colleagues and hear about how other people got there, and that's really how you're able to kind of get where you want to be. So as far as board certification, it's through the Board of Pharmacy, it's BPS services, I believe. So Board of Pharmacy Services. I could be wrong on that acronym. There's many acronyms. And they essentially have many different specialties. You can do pharmacotherapy, which is their general certification. oncology, infectious disease, cardiology. There's a ton. Essentially, most pharmacists, I would say, do start out with the general BCPS, and that can be taken after you complete your PGY1 or 3 years of clinical hospital work. So with that, if you don't do a residency, but you work in a hospital, you just have to wait for 3 years essentially to sit for that exam. And you go on a website, you sign up, you show your current, job status and how involved you are in clinical work. And that kind of makes you eligible for sitting for the exam. Usually people study from anywhere from 3 to 6 months for the exam. It's, I believe, 175 multiple choice questions. It's pretty similar to the NAPLEX, but very patient case and very clinical, not so much calculations and such. So with that, you essentially become board certified in whatever area you took it in. The specialties you'll be eligible to do that after you complete your PGY2, or if you're working in that area in a similar fashion. And that really gives you different things when you get certified based off of where you work. Some places it will kind of increase your advancement on the career ladder. Some places it may give you a little bit of a pay raise. Some places it may help your status, so you do less operational work, more clinical work. It's really hospital dependent at that.
Okay. That's something that I've always kind of wondered about, but
yeah,
I don't think I've ever really had described to me.
It's very confusing, and I really, like I said, as a student and as a resident, it's not something you really worry about. You just kind of talk about, and then all of a sudden it's there and you can sit for it and it happens. So
yeah, I had no clue that there are like requirements as far as like doing a residency or having certain X amount of years of kind of experience.
And then not only that, so every 7 years you have to recertify. So either you have to resit for a shortened exam, or you have to do continuing education credits. I believe it's like 120 hours in the last 4 years of your research, very specific books and very specific things to kind of stay up to date in literature.
Okay.
So
Makes sense,
it's
I think.
also a little bit of a cost. So that's something else you have to consider is the exam is costly, the certification every year is costly, and the continuing education is also very costly.
Yep. Sounds about right.
Yeah.
So maybe I should have asked this sooner, but it's okay. Was there a point when you knew you wanted to kind of pursue a clinical role in terms of a career, or is it something that just kind of happened because of opportunities lining up?
Sure. I think when I'm sitting back to thinking, in the middle of my core classes and just loving everything about core, you learn a lot about like inpatient management, outpatient management. And I really found the inpatient side of things really fascinating. I remember listening to Dr. Jacobson's electrolyte management talk, and I was just like, wow, like this is so cool how you're getting labs every day, you're checking, you're thinking about like what salt you're going to give the patient. And I just thought that was so neat how she talks from such experience of like, in the hospital, somebody's potassium is going to be this, and you have to think about what other things they might be on that could increase their potassium. And I really just enjoyed the puzzling of that. I also did work as an intern in the community setting, and I just knew that that wasn't going to work for me as a long-term option. And I also enjoy being on my feet and running around. So I shadowed an inpatient and community pharmacist before I even started pharmacy school, just to see what I would be interested in, which I would recommend anybody before starting a career to shadow. And I knew like inpatient, it was so cool seeing like the drug being verified and then the drug being processed and then seeing it get to the floor to the patient. Like seeing that whole process really made me appreciate that. I think I wanted to be in clinical, moving in that direction.
Right. Yeah, and I kind of agree on a lot of that. Like I've worked in a hospital for maybe 2 years now. And I still like, you see kind of the pharmacy operation kind of things like filling the machines and all that stuff. But it really wasn't until I had my first appy rotation at MGH where you kind of see like how pharmacists are really like kind of interwoven into the system, and the really like massive amount of value that you have as a pharmacist in the healthcare team and stuff. So
Yeah.
yeah,
I feel
it's
like we're a consistent sideline player, but sometimes when it's our time to shine, everybody's very
Mhm.
grateful for our help. So
Right. It's like you do a lot of patient cases and stuff in exams, and for a while it doesn't feel like it's something that we actually need to know how to do, but in reality, there are a lot of situations where you need to have those skills.
yes.
Let's see. So I think a fun question that we haven't touched on yet. How would you say URI has prepared you for your role as a clinical pharmacist at
Sure.
Mass General?
Well, if anybody's met me, they know I'm a big URI proponent. I enjoyed every second that I was there. I think URI is so unique in the faculty that it has. I was able early on to kind of get involved with 2 different projects with 2 different faculty that really, I think, launched my whole career. And they have such great connections. The whole school has such a great reputation with clinicals that there's no way to fail. It's just how much do you want to bite off and how much do you want to take on. There's a lot of research opportunities, especially with the BSPS, the 4-year program in research. There is so many opportunities for manuscripts and writing and kind of doing that type of research rather than lab research. It really depends on what you'd like. There's so many opportunities to get involved in the community. For example, Dr. Estes is so plugged in and really can help you get out and start a program or do something that you want to do. So I really think that there's so many available opportunities. You just have to kind of feel out what you want to do and what avenue you want to take, and then get connected.
Yeah, I would agree with just about all of that.
Yeah.
There's something that stuck with me when I was on rotation with you at Mass General, and I don't even remember the full sentence, but I remember the important part. And I think it was around the time of the midpoint review, maybe. And you said, like, I don't know if it's because I have like higher expectations of you because you're a URI grad or URI student. And I was like, huh, like, yeah, they really did do a good job.
Yeah.
Something to be
I
proud of for
definitely,
sure.
exactly. And I think you know, we always want to hold ourselves to that standard because we want to represent well. But I do think they've trained us in a really unique way that we have that reputation. Even, during residency across the country in California, I never even heard of the University of Rhode Island. And they were looking for residents from URI the next year because, it was such a strong year and you bring so much to the table, and who doesn't love a good old New Englander? So
Yeah. Tough to beat.
yeah.
Let's see. I think that was most of the major questions.
Sure.
Was there anything that you wanted to talk about or anything that you think you'd like to add just regarding anything about your role, URI, prospective pharmacy students?
Yeah. I think the biggest thing that I would tell anybody, P1, P2, P3 year is to get involved and get involved early on. Everybody wants to present something for mid-year or, they want a project to work on, and there's never a time too early to get involved with that. So I definitely encourage you, even if it's something small, reach out to your IAL professor or someone knows someone who needs some help, right? And they are able to kind of get you plugged in, and that might be your new project. So definitely take advantage of those opportunities, connect with faculty, as they will really be a huge, huge push for you to get where you want to be. And shadow as much as you can, really take a good range of rotations, really see what's out there. And if you want to pursue residency, I definitely think having those strong project management experiences before residency is a huge help.
Right.
So I think that's, I like what I do. I enjoy what I do. I enjoy being on a team every day. And I think that's definitely something that I've seen on both East and West Coast, as being a team player.